There are so many new faces on this page, which is very exciting. I wanted to take a minute and talk about prehabilitation and why you need to be doing it before your surgery, and also why most surgeons don't discuss it with you. I'm sure you have heard of rehabilitation. Rehabilitation is something that you do after an event to get back to baseline. For example, you have shoulder surgery. You might undergo physical therapy rehabilitation in order to regain your shoulder function after surgery. Rehab is a reactionary strategy to get back to baseline. Prehabilitation is a proactive strategy done before an event to optimize your outcomes, decrease the chance of complications, and get you back to baseline faster. Prehabilitation is like preparing for a marathon. You can certainly show up for the marathon and try to run all those miles, but it's not going to be as smooth and efficient if you would have put in the work ahead of time. Surgical prehabilitation is the same thing. Interestingly, the concept of prehabilitation stems back to the British Army, where they prehabbed their people in the military to allow them to fight more efficiently, ward off illness, and just be better soldiers. So they were working on their overall health, wellness, mental capacity to be the best soldier they could be. It's the same thing with prehabilitation. We want to make you the healthiest, the least stressed, best sleep person you can be before surgery. Now, why do we want to do this? We want to do this because studies have shown time and time again that optimizing even just one factor before surgery can improve outcomes. This was a lovely review paper that looked at this exact concept. And what it looked at was, first off, studies that have adopted a multimodal approach to prehab, meaning they did some nutrition, they did some stress, they did some exercise. Those were very effective at decreasing complications and getting people back to baseline faster. But the most important thing was that when they looked at just single interventions, so just improving your sleep, just improving your stress, just working on supplementation, also improved outcomes. Just one thing. Now, most surgeons won't discuss this with you because, one, we're not taught it in med school. That's not our fault. We're just not given that as part of our curriculum in medical school residency training. But also, we just don't have time. We don't have time to talk to you about all of your surgical options, the recovery, the risks, the benefits, the alternatives, and also how to adopt prehabilitation. And that's okay. That's what this page is for, a place for you to learn about how you can impact your surgical outcomes. So if you have questions or topics that you want me to address, drop them below and let me know.